Why do you blame your GP for the failings of the NHS? GPs are currently offering over 20% more appointments than they were pre-pandemic. And unfortunately, GPs are not valued as equal partners to providing great quality care. And regardless of the government promising more and more GPs, what we're actually seeing is fewer doctors working. This is because retention of staff is a massive problem. There's a workforce crisis in the NHS, and in particular in general practice. GPs are leaving the profession in droves, and even though there are plans to increase the number of places at medical school, this is only putting a plaster over a gaping wound. In the abridged words of Adam Kay, there's no point in turning the taps on if you've still got the plug out. The more senior doctors leaving the NHS means that there are fewer training opportunities for the junior doctors, and there is a growing reduction in the wealth of experience that usually gets relied on. For example, I had a patient recently who was about 70, but had some lower tummy pain, pain on passing urine, and they hadn't opened their bowels for a week, despite me having been a doctor for 8 years. And what sounds like a fairly straightforward presentation, when I spoke to one of my consultants about it, he asked for some investigations which I initially thought may have been unnecessary. And I asked him to explain his thought process to me just so I could learn. And he said to me that it's not really a thought process, it's just a sixth sense that he thinks that something is not quite right. So we requested a CT scan, and lo and behold, it showed multiple problems. There was a problem with the urinary tract system with a blockage which was leading to the kidney becoming swollen, and more pertinently, there was an inflammation and infection of the bowel which had perforated. So essentially this person had burst part of their colon. The reason that I felt that this investigation may have been unnecessary to begin with is because this person looked so well. All of their numbers, so heart rate, blood pressure, temperature, everything was completely normal, and they were able to walk around and chat freely without any struggle. And this is why a wealth of experience is so important at training younger doctors. Why can't you get a GP appointment? It's interesting because since 2019, the number of appointments available has increased by 20%. In November 2022, it's estimated that there are around 33 million appointments in that month alone. And it's the GP partner model which has enabled this to happen. Because GP partners need to respond and react to the changing demands of the population in order to continue to run a profitable business. And on that note, having a salaried GP model alone would not be able to respond and react as quickly as we would need to these ever-increasing work demands. The reason that the partnership model has been so successful in offering so many more appointments over the last few years, and in very challenging circumstances, is because it is a task and finish model rather than just a clock in, clock off model. If there were just fixed workloads with a salaried GP model, then there would be no scope to adapt to the local population's needs. And despite this high number of appointments that we're offering at the moment, the reason that we can't keep up with demand is because there are simply not enough GPs. And when we speak about the number of GPs, I don't mean in broad numbers. I mean in terms of the full-time equivalents. So full-time is typically regarded as 8 or 9 sessions a week. It's estimated that you would need 2 or 3 salaried GPs or managers to replace the work of one partner. This is because partners are responsible for overseeing the clinical work, the clinical governance, the HR roles, the needs of the local population, estates management, and even seeing their own patients. A lot of this work is done in their own time because they have vested interests as small business managers, as well as being clinicians. On top of all of this, the number of GP partners has declined steadily since 2015. This is usually due to ever-increasing workloads, burnout, and retiring. Smaller GP surgeries are merging and forming larger centres. These centres are usually much more reliant upon allied health professionals. These professionals are excellent at what they do, but they need training and they need supervision. GP partners who are business owners will often be providing this additional support for free because it's in the interest of the business. In a purely salaried model, the GPs will need to be paid for this extra service and have the time protected. A lot of people talk about the money that GPs earn, and a figure of £150 per patient per year is thrown around quite a lot, particularly in the comments on my videos. Now that's pretty much the upper limit of what a GP can earn from a patient. There's something called the global sum, which hovers just under £100 per patient per year. And this is given to the practice regardless of the number of times a patient visits the surgery. For example, if they visit the surgery 30 times in a year, that number stays the same. Now there are some additional enhanced payments which are awarded to surgeries if they hit certain targets. And these targets are focused around matching the health needs of your population. So really, the total per patient per year goes up to about £130. Some practices may earn up to £150 per patient per year. Now, all of this is based on a historic view that on average, patients will only visit their surgeries once or twice a year. What we've been seeing recently is that patients visit their GP surgery between 6 and 7 times on average each year. And this has increased over the last 10 to 20 years. So if we take the lower end of the number of visits to 6 visits per patient per year, and let's say we've maximised the earnings for a surgery to £150 per patient per year, then that means that the value of one consultation is £25. So that's £25 for a 10-minute appointment. This same appointment within the private sector can cost anything up to £250, even more in certain situations. There are many reasons why the NHS is failing, but it is not because of general practice.